The first question would really be just to learn more about you, your title, role, responsibilities. If you want to share those and anything relevant, please do. And that would be very interesting.
Okay, I'm currently on a company named DLI. We're a digital pharmacy specifically to diabetes, but also metabolic syndrome that englobes diabetes, overweight or obesity, high cholesterol, and specifically hypertension. So that's the four things we tend to focus on. And right now, one of the many challenges, and I think that's where we make a good fit with this interview, is the challenges of not having a point of sale. Because of us being digital, we have to innovate in certain ways to get clients, because it's not the same to have someone pass by your store and just see the products. You have to make the clients come via Instagram, Facebook, Google, or many other channels. Right now, we're becoming Amazon sellers. We already have Rappi, that it's an app here in Mexico, that it's Colombia, but I mean, it's one of the services they have. And we're trying right now with Uber also. So, I mean, it's one of the challenges we have. And my current position is head of business growth.
Okay. Can you talk about the last time you used some organic growth methods like SEO, content, or maybe other methods?
Yes, actually, we just have a major SEO performance redo in the page because we have lots of issues. I mean, some of text, images, but I think the best organic tool we have, and I think most of the market is going towards that trend, is building community, right? So I think for most people, and here in Mexico, we see it a lot. I mean, we have a lot of diabetes here in Mexico, but people don't want others to know they have diabetes. They think they will treat them differently or saw them differently. So one of the many challenges is how you make a community where the people feel safe to speak of their problems, figures, or some influencers or some people that live with the disease, but they talk about it normally and document their day to day and the good things and the bad things. So the people are more open to accept the diagnosis and to treat themselves. I think that's the biggest issue we have here in Mexico, is not the diagnosis or that the medical institutions don't make the correct diagnosis. It's that the people don't take care of themselves because they've spent 40 years eating whatever they want, or maybe they are just in denial and don't want to, or they have the idea that insulin will make them blind, or a lot of misinformation happens here, right? So I think the best organic growth that a service like us can have is build a community where the people inside feel safe to ask questions, to educate themselves, to have actual good and on point information, because that's another challenge. Where do I find information that's true? We see this a lot today. We don't believe in anything that big pharma says or doctors or specialists. We're starting to doubt if those are true. So a lot of misinformation happens and people believe many things. We're also a country heavy on religion. So many are just on the side of, don't worry, I'll just pray and I'll be fine.
No.
So, I mean, there's a lot of challenges, but I think that's the best one. We do also paid promotions, mainly on Google. It's because how Google works, but on their respective websites of social networks, the main focus is just to give information to the patient and create a safe space for them where they feel at peace.
Makes a lot of sense. I have a lot of family with diabetes, so what you're saying to me makes so much sense. And I suppose in that process of growing organically through mostly community building, but maybe you publish content or, like you said, renovate your homepage with SEO. What's the most difficult?
I think the hardest challenge is to find the actual good communication channel and the content. Because at first we started promoting discounts or specific medications or specific products that we thought would make people come to our page. And then we realized that that wasn't the case, that people don't go because you have product they need. They go because they trust you, right? So if you're a page that nobody knows, that, I mean, it's digital, so I can see the product. I can only see it when it arrives to my home. You have the confidence in Amazon right now, right? But I mean, someone that orders them, or I lost the other one that was very famous years ago. Yes, Alibaba, and there was another one. Don't worry, but I mean, it's the same example, right? That, I mean, you order and maybe you get a good product, maybe you don't. And I mean, it's cheap, so you don't worry. But with medications and with your health, there's a big component in trusting the company, right? Because maybe I order an Ozempic, and I mean, with all that's happening with all the GLP ones, maybe it's fake, maybe it's not a good one. So I think our biggest challenge was to get the right message to our users.
Makes sense. And I suppose, like, if you had a magic wand here, what would you do?
For me, I think and it's something we're trying to do, that it's not for the pharmacy per se, but it's a concierge app for diabetic patients. It's an app or a service. One of the objectives we have is to create a service that allows patients not only to interact with each other on social network, but also ask questions to us. We have a model that allows people to resolve any questions they have about their disease, if they need a consultation. Some of the things we're doing is partner with laboratories and clinics, so that a patient that comes to our page can schedule a consultation or schedule a follow-up study if they need one, and create a space where the patient doesn't only buy the medicine, but they have everything they need to take care of their disease, right? So I think that's like the thing I would do. I think an app is great, but has its challenges. I think the service is the key, right? People, especially in health. I mean, my background is I studied medicine and then I did industrial engineering. So as a doctor, when I went through med school and having my practices at the hospital, that was one of the greatest challenges, right? Like the patient doesn't have enough time, or the doctors don't have enough time to explain properly to the patient what's happening to them, what's the care they have to do. Every little step, it's hard in a 30-minute consultation. So I think this service helps people obtain the right information and have someone of trust that they can contact every time they want, right?
Yeah, it makes sense. It's almost like be the CEO of your own health type of trend happening. And like you said, it's not enough time to provide that white glove service. And I suppose, like, when it comes to tools that help with this growth organically, like it could be SEO tools, it could be content tools or community tools, like, what do you think is missing?
That's a very good question. I think a good integrating tool for all your traffic, right? Because you have Google Analytics on one hand, and maybe you can do some UTMs, and you have from Meta people incoming, and then you have people from your QR and your YouTube content, and maybe you did a blog, and I mean you get all these users, but you don't actually know, or the moment that they get to you is different, right? Because in Google is someone that's actively looking for your product, let's say. But on Instagram, it's rarely someone that's looking to buy, right? A lot of this traffic gets mixed or gets duplicated, because if I have analytics on Google, I have both my Google visitors and also all of the Meta and other campaigns in there, and they get mixed up. You can do the work and know where every user is coming from,
Mhm.
but not that easy as it seems.
Attribution is difficult. No, it makes sense. I don't think we have those tools yet, indeed. um,
I
maybe
mean, it's hard, right? But I mean, it has to do not only with its different platforms, but also every platform has its own compliance and privacy policies. So there's some things you just can't do. Meta is more open in that regard, but yeah, I mean, it's
Yeah.
mostly privacy policies.
And I suppose that's where the open-ended questions ends.